Hello, class. We're going to begin our discussion on the clinical anatomy of the foot and ankle complex. So from a bony anatomy perspective, we know in the distal leg we would have our tibia and fibula. Distally in the foot, we've reviewed in class the various tarsal bones as well as the metatarsals and phalanges. So we're not going to go into too much depth with that here. From a cutaneous nerve perspective, on the anterolateral surface here, we can see we have the superficial fibular nerve, and then it bifurcates, terminating as the medial and intermediate dorsal cutaneous nerves of the foot. Laterally, on the posterior aspect here, we can see the sural nerve coursing down the posterior and posterolateral aspect of the calf, winding down around the lateral malleolus and terminating as the dorsal lateral cutaneous nerve of the foot. Over on the medial aspect of the leg as well as the foot, we can see the saphenous nerve. This is the largest terminal branch of the femoral nerve, and it travels with the, again, afferent pathways, both venous system and these cutaneous nerves. They're both afferent or going proximally. This saphenous nerve will be traveling with the great saphenous vein. The great saphenous vein here in blue drains the anteromedial aspect of the dorsal venous arch. And then the posterolateral aspect of the dorsal venous arch is going to be drained by the small saphenous vein, which courses again kind of with that sural nerve up along the posterior and posterolateral aspect of the leg and calf. From an arterial supply perspective, our anterior and posterior tibial arteries, we'll talk about the anterior tibial artery first. Again, this traveling in the anterior compartment of the leg, coursing down here, and after it crosses really the ankle, it'll become the dorsalis pedis artery, and then dive deep as the deep plantar artery, and then obviously contributions to the arcuate artery as well. On the plantar surface, posterior tibial artery is going to basically wind around here on the medial surface or the medial aspect of the plantar surface of the foot and bifurcate into the medial and lateral plantar arteries. Muscular-wise, really two muscles we need to talk about on the dorsum of the foot. We have here our extensor hallucis brevis, and then over here extensor digitorum brevis. On the bottom of the foot, we can see here we have the plantar aponeurosis or the plantar fascia. If we reflect that, we'll go through our four different layers of intrinsic muscles. And the first layer here, most medially, we have abductor hallucis. We'll reflect that. In the midline, just deep to the plantar fascia, we have flexor digitorum brevis. And then over here, abductor digiti minimi. Now, important plane here between the first and second layers, because this is our neurovascular plane. This is where our lateral plantar neurovascular structures, lateral plantar nerve, lateral plantar artery and vein, this is where they are passing. So they're between flexor digitorum brevis as well as quadratus plantae. In the second layer, we have our quadratus plantae muscle, tendon of flexor digitorum longus, tendon of flexor hallucis longus, and then our different lumbricals that are going to be attaching to the tendons of flexor digitorum longus. So if we reflect quadratus plantae, we will reflect our lumbricals, and we'll get into the third layer. We'll reflect our tendon here of flexor hallucis longus. Okay. Flexor hallucis brevis here in the third layer. Oblique head of adductor hallucis, transverse head of adductor hallucis, and then we have our flexor digiti minimi brevis. We'll reflect these muscles. And then our fourth and final layer of the intrinsic muscles, we have our plantar and dorsal interossei. So we can see our plantar interossei here is the first plantar interosseous muscle. Dorsal are a little bit more, again, towards the dorsum of the foot, but still counted as an intrinsic muscle on the plantar surface of the foot. Really going to be best located in a dissection perspective. In the anatomy lab, it's going to be best located on the dorsum of the foot after you reflect the tendons of extensor digitorum brevis and extensor hallucis brevis. Now, soft tissue structures that support the arches, again, all these intrinsic muscles are designed really to support the arch of the foot. In particular, abductor hallucis, flexor digitorum brevis, and quadratus plantae. Those in conjunction with this long plantar ligament, as well as the plantar fascia, those will be our primary inert stabilizers, whereas the plantar intrinsic muscles are more of our dynamic stabilizers. So a patient who presents with heel pain, we would certainly want to consider that, as a lot of these particular structures attach to the medial calcaneal tubercle.